My name is Dr. Sahin. I am the oral surgeon. I graduated from the Istanbul University, the eldest, at the same time the biggest medicine faculty of the Turkey. I have about aesthetic cosmetic dentistry, lots of certification, also reimplantation. But the most important two certificates I can tell from Professor Alper from Istanbul University, bone augmentation, bone transplantation certificates. I'm very proud about them. Also, laminate veneers education from Yeditepe University, Professor Esra. Also, about digital supported implantation, I wrote 96 pages thesis on this.
Speaking about veneers, what is the procedure of veneer placement, and is veneers indicated for every patient, or sometimes it's not possible?
Yeah. Laminate veneers, nowadays it is the most common way to change the cosmetically the teeth shape, surface, colors, and very successful treatment I can say, but you should choose the patients very well. If the patient's jaw, bone, teeth size suitable or not suitable with this treatment. And for example, relationship between upper and lower jaw is very important. If patients cannot bite properly, laminate veneers can be unsuccessful with these patients. Also, material very important. There are lots of brand marks in that area. The doctor should use the good brand mark. Actually, laboratory should use good brand mark, and the doctor also should check this brand mark in laboratory. I prefer Emax brand mark, Evoclar, based on Germany. We are also using their glue materials in our clinics. But I said laminate veneers nowadays in social media, in everywhere, doctors try to show the patients like a very easy treatments. It can be easy treatment, of course, if patient is suitable. But some of patients' mouth is not suitable with this kind of treatments, and they always push to doctors for laminate veneers, and sometimes they can have some unsuccessful results because of that. So doctor examination is very, very important, especially the bite records. The patients are biting properly or dysfunctional biting. If patient can, if doctor choose really suitable and they use the good materials, good brand marks, it's very successful and common treatment for changing the cosmetically the teeth.
Can we understand with X-ray that the patient is suitable for the veneers?
All of the pictures of biting style, then we decide, not just X-ray. X-ray plus the pictures, but from the good angle, of course. Yeah.
And how long does veneer last?
Veneers 1 week already enough.
In 1 week, in one
one
visit,
visit, yes, finish. Yeah.
I mean, how long the patient can use veneers? Should the veneers be replaced?
Yeah, we give our treatments like a 10 years guarantee, but if patients loyal to rules, keep oral hygiene properly, for example, for lifetime, they can even use their veneers. In literature, they said, in, for example, university, they teach us, if a patient use 7 years a restoration, it can be veneers, it can be crowns, it can be metal fused porcelain even. It means it is successful treatments. But we always want patients, of course, use their restorations as much as possible, as long as possible, so of course. Yeah.
I see. Could you advise patients how to choose the clinic and the doctor properly, where to see which doctor and clinic is good or not? How to
Let's I answer these questions. How I choose my doctors when I go to visit or some hospital, or if I need some doctor medical time treatments. For me, the most important things is communication between the patients and doctor. Very, very important. Doctor can understand my expectations, listen to me or not listen to me. This is very important. If I visit a doctor and this doctor is not listening me enough, I would never visit this doctor again. I can say this is the first I can tell. Or if I need some emergency troubles can be. Because all of this surgery, all of these complicated treatments, and sometimes patients can have troubles. And it is not easy to reach the doctor, especially in European countries and also Scandinavian countries and the UK. I have lots of patients. It's not easy to take appointment from the doctor and sort out the troubles. Even I have some of patients, a family, come from Switzerland just for receipt antibiotic. Just for antibiotic, buying antibiotic. They come to me, I receipt antibiotic them, they bought and go back to Switzerland. So, can patient reach the doctor or not also? The second, I can say this is very important for me. And another, I can tell experience, very important for me. And doctor, you can know theoretically all of the informations, but do you have enough practice or not? This is also important. You can imagine, for example, some surgery in your mind. Technically, theoretically, you can have all of the information in your mind, but how many percent you translate all of this to your hands? And it's related with also experience. I can tell this is. As a material also, I can tell it's very important. Does your doctor giving certificate or very transparent with you or not? This is very important also for me. I want to inform everything in transparent, complications and other things. Or if, for example, when the biggest problem, for example, of patients from another clinics, what I live. For example, patients had implant before 6 months ago. They didn't give any paper or some certification to the patients. Clinic closed. Patients come to us and they said, I have an implant, I want to make top of these implants. But patient doesn't know which brand mark, which size, which model of the implant. Clinic or doctor didn't share any information with the patients and put the patients in very desperate position. This is also very important. If I would be a patient, I try to check like a doctor share all the information with me or not. X-ray, certificates, all of the treatment information or not.
Thank you very much.
You are welcome.
It was
Nice
very
to see
interesting
you.
talk. Thank you.
You are welcome, always.